How's it going, guys? We have a past level question for neuro for different steps. 72-year-old man, he's got a TIA, transient ischemic attack, which is stroke-like findings under 24 hours. Most patients, it's under 1 hour. And he's got his right side of the face and right arm affected where there's weakness, hypertension managed with hydrochlorothiazide, and our physical neurologic exam shows slightly sluggish patient but no overt abnormalities. That confirms the TIA, so the symptoms have dissipated by this point. Vitals are normal except for elevated blood pressure. It doesn't have to be 180 over 100. They can give you 140 on 90 of CNIT and BME. So what we have here is a carotid plaque caused by hypertension where the atheroma is launched off to the brain/eye. That's what can happen. Okay, so you get stroke, TIA, retinal artery occlusion. Here we have TIA. The other high-yield cause of stroke caused by thromboembolus is atrial fibrillation, or left atrial mural thrombus has launched off to the brain/eye. So let's look at the location here. We've got weakness of the right arm and face, so the stroke's going to be on the left side. It's always contralateral. And we're not assessing that here, though, but we're going to look at is anterior middle cerebral. It's going to be middle cerebral artery. So the first pass level point is that your face and arm affected, always contralateral middle cerebral artery. Okay, the leg is affected, that would be contralateral anterior cerebral artery. That's the first point. The second point is the middle cerebral artery is always going to be the lateral hemisphere in terms of the homunculus. That's the part of the brain that's affected. So there's no such thing, at least for USMLE purposes, there's no such thing as middle cerebral artery medial hemisphere combo. There's no such thing as anterior cerebral artery lateral hemisphere combo. Those answers don't make sense. Okay, so you have anterior cerebral artery medial hemisphere, that's your contralateral leg, or you'd have middle cerebral artery and the lateral hemisphere together, that's your contralateral face and arm. So we know that we're dealing with only E or G here, middle cerebral arteries with lateral hemispheres. So now you need to know that if you are experiencing motor dysfunction, it's going to be anterior to the central sulcus. So our correct answer is E. If we had sensory abnormality instead, we would be posterior to the central sulcus. Now, other things you can know is that if you have a dominant side middle cerebral infarct, as we would have here, most patients, if they don't say anything, the left side of the brain is dominant in most patients. If they're left-handed, it can be the right side of the brain that's dominant, but left MCA infarcts can also be associated with Broca and Wernicke aphasias, global aphasia, transcortical aphasias. Okay, that's the left side of the brain. And then the right side of the brain, non-dominant MCA, is your hemi-neglect, where they can't draw the clock face properly. Posterior cerebral artery, that's going to be two things in USMLE. It's going to be prosopagnosia, inability to identify faces. It's the first time you're hearing it, sounds weird, it's buzzy. The second thing is contralateral hemianopia with macular sparing. Okay, so I'm going to ask you right now, just a quick recap. If you have a patient where they tell you the left leg is affected, which side of the brain is affected? Okay, it's the right side, not hard. So if our left leg is affected, the right side of the brain is affected. If we tell you there's sensory abnormalities in the left leg, are we anterior or posterior to the central sulcus? We're posterior to the central sulcus. So we said if it's motor abnormality, you're anterior to the central sulcus, sensory is posterior to the central sulcus. And are we going to be medial or lateral hemisphere? Or medial hemisphere. Okay, so if you had sensory abnormalities in the left leg, you would have medial hemisphere on the right side, anterior cerebral artery, posterior to the central sulcus. Choice E, correct answer.